Good day everyone, we are Group 6 of A66A presenting the laboratory exercise 9, which is about the muscular system. Just a brief introduction, the muscular system is closely linked with the skeletal system, and the skeletal muscles involved for this activity are responsible for movements. These muscles are attached to the bones by what you call a tendon, which are connective tissues. The aponeurosis is a flat tendon-like material that connects a muscle to the body part where it moves. To recap, there are three things we have to consider when describing a muscle, and these are the origin, which is a muscle's proximal attachment, the insertion, which is the movable point of attachment, and lastly, the action, that is described using the following terminologies. Adductor, which is to move a part of the body towards its main axis, abductor, which is to move a part of the body away from its main axis, extensor, to move jointed parts away from each other. Examples of this is the longissimus dorsi and triceps brachii, which will be discussed later on, and the flexor, which is to move jointed parts towards each other, and an example of this, coming from its name, the flexor tarsi anterior. Then we also have circumduction, to move a part in a circular motion, and we also have rotation, which can be lateral or medial rotation. Next is the levator, which is to raise a part, and lastly, the depressor, which lowers a part.
Towards the end of the exercise, we should be able to gain insights and knowledge on the proper ways of dissecting the frog or toad to demonstrate muscle groups. We are also expected to learn how to identify the major muscles in the frog or toad. And lastly, to understand how to relate the action of the muscles based on their anatomical location and attachment.
The materials to be used if the activity was done on site are the following: preserved frog, toad, dissecting pan, dissecting set, which must include forceps, pins, scissors, and scalpel.
Now let's proceed to labeling the muscular system of the frog. For part A of part 1, we are to identify its ventral muscles. For the ventral muscles, we first have the sternoradialis. The sternoradialis is a thick sheet of muscle that is partially covered by the posterior margin of a muscle called mylohyoid. This muscle originates from the episternum and omosternum and is inserted into the proximal end of the radius. In addition, it acts as a flexor to the forearm. Posterior to the sternoradialis is the cutaneous pectoralis, which is a thin muscle originating from ciphisternum and from the sheet's anterior rim that surrounds the rectus abdominis. Its insertion is the dermis of the skin at the chest area, and it tenses the skin that overlies the pectoral girdle. Then we have the pectoralis, which is a group of muscles that can be divided into three parts: anterior, medial, and posterior pectoralis. This ventral muscle is located posterior to the sternoradialis. Its origin is from the sternum, insertion is to the humerus, and its actions are as follows: adductor, flexor, and rotator of the arm. Next is the external oblique, originating from the ilium and dorsal fascia of vertebrae, inserted through the linea alba and gives support to the viscera and contributes to the constriction of the abdomen. We also have the rectus abdominis. Its origin is from the pubic border, and its insertion is through the sternum. It acts as a support to the abdominal viscera and allows the sternum to be in place. The rectus abdominis is lateral to what we call the linea alba, a connective tissue that can be found in the mid-ventral portion of the frog. Then we have the triceps, the adductor magnus, and the gracilis major, which will be explained further later on. Next is the sartorius, a strap-like muscle with its origins from the pubis. Insertion is to the tibia fibula and acts as a flexor to the shank and an adductor to the thigh. Now let's proceed to the ventral muscles of the head. First, we have the submentalis. It originates from the anterior tip of the mandible. Its insertion is through the anterior angle of the lower jaw, and it raises the tip of the lower jaw. Second is the mylohyoid, whose origin is from the median surface of the mandible, and is inserted to a connective tissue called the median raphe. This muscle raises the mandible when swallowing or breathing. Third, the geniohyoid, whose origin is from the median surface of the mandible as well, and is inserted to the posterior cornua and thyroid processes of the hyoid. The hyoid is drawn forward and upward by this muscle.
So now we have the triceps femoris. It has three origins. First, the vastus externus, dorsally located, crest of the ilium. Second, the tensor fascia lata, medially located, ventral side of the ilium. And third, the vastus internus, ventrally located, acetabulum. Its insertion is in front of the tibia. It extends the leg and draws the hind limb forward. Next is the adductor longus. Its origin is in the ilium and its insertion is in the femur. It is the adductor to the thigh. For the adductor magnus, its origin is in the ischium and pubis. Its insertion is also in the femur, and this muscle adducts to the thigh and leg, and it is a flexor and an extensor to the shank. Next, we have gracilis major. Its origin is in the ischium, and its insertion, on the other hand, is in the tibiofibula. It flexes the shank and adducts the thigh. Tibialis posticus origin is in the femur. Its insertion is also in the astragalus, and its action depends on the position of the foot. It flexes and twists the ankle. Next, we have the scapulohumerales, also known as the deltoid. Its origin is in the scapula and its insertion is in the deltoid ridge. It is the adductor of the forearm. We have the external oblique lastly. Its origin is in the lower 8 ribs and its insertion is, on the other hand, is in the linea alba, and its action is that it flexes the trunk and increases abdominal pressure.
Moving on for part B of part 1, we are to identify and label the dorsal muscles of the frog. First is cucularis, which is found on the mid-dorsal line. It is inserted on the portion of the pectoral girdle and it draws the forelimb upwards. Next is latissimus dorsi, which is found on the lumbodorsal fascia. It is inserted on the lateral side proximal end of humerus and it allows the forelimb to move upward and backward. Then, we have iliolumbaris, which is located on the anterior of ilium. It is inserted on the transverse processes of trunk vertebrae and it bends back. Next is longissimus dorsi, which is found on the urostyle. It is inserted on the posterior portion of the skull and anterior vertebrae and it extends the pelvic area. Next is coccygeosacralis, which is located on the lateral half of the urostyle. It is inserted on the transverse process of sacral vertebrae and it draws the back of the urostyle nearer and nearer to each other. Moving on, we have coccygeoiliacus. It is situated on the lateral posterior half of urostyle. It is inserted on the ilium and it extends back. Next is triceps femoris, which has been mentioned earlier. Moving on, we have biceps femoris, which has 2 heads. The long head is found on the ischial tuberosity while the short head is found on the linea aspera. They are inserted on the lateral head of fibula and they extend the thigh, flex the knee, and allow external rotation. Lastly, we have peroneus, which is located at the distal end of the femur. It is inserted on the proximal tarsals and it flexes the foot.
Next is the gluteus, which is a thick muscle but small in size, which may be located anterior to the vastus externus and medial to the rectus femoris. Then there's also triceps femoris, which has been mentioned previously. We also have the semimembranosus, whose origin is at the posterior part of the ilium. Its insertion is the proximal end of the tibiofibula and acts as a flexor to the shank. After that is the gastrocnemius, situated at the back of the shank, whose origin is at the distal end of the femur and the anterior portion of the knee. It is inserted through the ankle of the foot and acts as an extensor of the foot. And finally, the peroneus, which has been discussed earlier as well. Now let's proceed to the guide questions. For number 1, give one example of a muscle that is responsible for the movement of the following: upper arm, feet, and thigh. For the upper arm, an example of a muscle that is responsible for the movement of this part is the pectoralis.
Tibialis anticus is an example of a muscle responsible for the movement of the feet. It originates from the femur and is inserted on the distal end of the astragalus and calcaneus. Additionally, it enables the feet to be flexed.
An example of a muscle that is responsible for the movement of the thigh is the sartorius. As mentioned, this is a ventral muscle that originates from the pubis and is inserted into the tibiofibula. This muscle is involved as it adducts the thigh. For guide question 2A, identify the principal muscles involved when the frog leaps.
As the frog leaps, several muscles are utilized to perform this movement, such as the gluteus, semimembranosus, gastrocnemius, extensor cruris, adductor magnus, and semitendinosus. These aforementioned muscles serve as extensors as the frog leaps. In addition to that, these extensors, specifically the leg extensor muscles, allow frogs to have exceptional jumping ability due to the high power output these muscles provide.
For guide question 2B, identify the principal muscles involved when the frog resumes a sitting position.
The principal muscles involved when a frog resumes a sitting position are muscles that act as a flexor, and these are 1. Pectoralis, 2. Latissimus dorsi, 3. Gastrocnemius, and 4. Sternoradialis, 5. Sartorius, 6. Adductor magnus, 7. Gracilis major, 8. Gracilis minor, 9. Semitendinosus, 10. Tibialis posticus, 11. Flexor tarsar anterior, 12. Tibialis anticus, 13. Biceps femoris, 14. Semimembranosus, and 15. Peroneus.
Going back to the objectives mentioned earlier, we were able to demonstrate the first two objectives by identifying the distinct muscles of the frog. We were also able to showcase the third objective as we have identified the muscles that contribute to the movements of certain parts of the frog, which are the upper arm, feet, and thigh. We were also able to identify which muscles are involved when the frog leaps and when it resumes a sitting position. And that concludes our post-laboratory discussion. Thank you.